A major new study has uncovered an alarming connection between long-term exposure to air pollution and significantly higher risks of depression, offering yet another disturbing layer to the public health crisis surrounding environmental degradation. The findings, published in Environmental Science and Ecotechnology, draw a clear and troubling line between dirty air and deteriorating mental health, one that implicates some of the most common urban pollutants, especially sulfur dioxide (SO2), in the growing epidemic of depression worldwide. Using data from over 12,000 participants in the China Health and Retirement Longitudinal Study (CHARLS), researchers from Harbin Medical University and Cranfield University have painted a bleak picture of what living with chronic exposure to air pollution really means for the human brain. While we've long known that air pollution harms the heart and lungs, this study adds weight to a darker, less visible consequence: that dirty air may quietly be dismantling mental health in entire populations. What's particularly unsettling is how even relatively low but sustained levels of pollutants can produce significant psychological effects, often without obvious physical warning signs. Among the various pollutants studied, sulfur dioxide stood out as the most damaging to mental health. Known for its corrosive smell and toxic properties, SO2 is a byproduct of burning fossil fuels, especially coal, and is prevalent in industrial regions. Its capacity to infiltrate and inflame the respiratory system is well documented, but this research shows that the damage may extend far deeper, reaching into neural circuits and cognitive functions that regulate mood. Fine particulate matter, PM2.5, and carbon monoxide, CO, were also found to be strongly correlated with increased depressive symptoms, suggesting that this is not a single-agent problem but a toxic blend of exposures with compounded effects. Worse still, the pollutants do not act in isolation. The study highlights a synergistic relationship between different pollutants, where simultaneous exposure to SO2, PM2.5, and CO creates a far greater risk of depression than any one of them alone. This multiplier effect raises serious concerns about how current air quality guidelines, which often assess pollutants in isolation, may be failing to capture the full scale of the health threat. For people living in densely populated urban areas or near industrial zones, this combination of exposures is not hypothetical. It is a daily reality, one that silently chips away at psychological well-being. The biological mechanisms proposed by the study make this even more unsettling. The researchers found that the relationship between pollution and depression was partially mediated by declines in cognitive function and physical health. In other words, air pollution may be indirectly causing depression by weakening both the body and the mind. It slowly reduces physical vitality, impairs memory, attention, and other cognitive skills, and eventually creates the conditions for emotional breakdown. This paints a deeply disturbing picture of environmental pollution as a stealth operator, degrading human life not only through acute disease, but by undermining mental resilience, emotional stability, and even identity over time. The implications for public health are massive and damning. Millions of people across the globe, especially in developing nations and economically disadvantaged regions, are breathing air every day that may be chemically programming them toward depression. Older adults, who already face higher risks for cognitive decline and social isolation, are especially vulnerable. Yet despite decades of warnings from environmental scientists, regulatory action has lagged woefully behind the reality of the threat. The psychological damage linked to air pollution is likely already contributing to the rising burden on healthcare systems, including increased prescriptions for antidepressants, higher hospitalization rates for psychiatric conditions, and a surge in disability claims related to mental illness. And still, many governments have failed to treat air pollution as a mental health issue. While physical illnesses like asthma and cancer linked to environmental factors receive considerable attention, the emotional and cognitive toll of polluted environments remains largely ignored in policy discussions. That must change. This study provides yet more evidence that clean air is not merely a luxury or an environmental preference. It is a fundamental prerequisite for mental health and social stability. The failure to act swiftly on this knowledge would be nothing short of negligence. Regulatory agencies must move beyond piecemeal interventions and embrace a comprehensive, enforceable strategy to reduce pollutant levels, starting with sulfur dioxide and PM2.5. Industrial emissions must be reined in with stricter limits, Urban transportation systems must be overhauled to cut down on CO emissions, and long-term monitoring must be improved to capture the full psychological toll of pollution exposure. Public health messaging must also shift. Depression is not always just a chemical imbalance or a product of personal stress. It can also be the result of toxic exposure in the air people breathe every single day. This study doesn't just raise awareness, it rings an alarm. If we ignore it, we risk allowing environmental neglect to morph into a global mental health disaster. The air around us is shaping our minds in ways we're only beginning to understand, and if we fail to protect it, the consequences may be far darker than we've dared to imagine.